The partnership that we have with Inglis and Methodist is really designed to create a new opportunity where we're building a new housing complex which will be 47 units for people who are low income, homeless, or medically compromised, and connecting them also to a collaborative of healthcare providers that are designed to create systems that facilitate medical care and housing to improve health.
This project is an example of us trying to help address those more front-end issues that affect long-term health and ultimately the cost of healthcare in the country.
When they came to the table and said, we want to invest in housing as healthcare, we said, well, we have the right opportunity for you. And they have been not just financial partners, they've been collaborative, inspirational partners as well.
We're going to fight for you. We'll do whatever we can to convince all the appropriate people to make the best decision, to be their best selves on decision-making day, right? You want everybody to be their best selves, all right? And see this project as one that should be at the top of the list. It should be very well get funded.
This joint venture between Methodist Services, Inglis, as well as the larger Philadelphia Housing and Health Collaborative is the kind of work that's required to meet the demand for housing in Philadelphia and across the Commonwealth.
When you provide predictability, when you give people a place to stay, when you deal with some of the holistic issues, whether it's behavioral health and physical therapy, you relieve them and give them life.
I realize the challenges that we have when we're trying to provide housing for our citizens that have a physical learning difference. And although they may not be here today, they're here in spirit for all the work that you do. So on their behalf, I thank you for the work and thank you for this project.
When you integrate all of those services together, people have better outcomes and healthcare costs decrease. So that's what we're focused on, and we're going to look to gather data to prove it here.
If we can truly show that this does ultimately change the overall trajectory of the cost of healthcare, then there'll be more funding for us to be able to do the things that we need to do and find funding for future projects.
So we are planning on changing all of that by creating within our own community not only new high quality housing, but also the connections to the healthcare system that people need.